Common peroneal nerve. So this is the posterior part of thigh, the popliteal fossa, posterior part of the leg. Here the nerve of the posterior part of thigh is sciatic nerve. The nerve comes from lumbosacral plexus. Here we can see the nerve comes through the greater sciatic notch and enters posteriorly in the gluteal region and descends down to the posterior compartment of thigh between ischial tuberosity and greater trochanter of femur. So what is the root value of sciatic nerve? It arises from L4, L5, S1, S2 and S3. So this is sciatic nerve. The nerve has two components, tibial component which comes from L4, L5, S1, S2, S3, common peroneal component which comes from L4, L5, S1 and S2. So here the same sciatic nerve has two components. Tibial takes origin from all the root values L4 to S3, whereas common peroneal till S2. So here the nerve passes through greater sciatic notch from passing through the gluteal region. It just comes beneath the piriformis muscle. So the nerve lies just below the piriformis and crosses these three muscles, obturator internus with superior and inferior gemelli, which is attached to upper part of medial surface of femur. Just below that, here to the quadritubercle is quadratus femoris. The nerve enters the posterior compartment of thigh. And in the thigh, the nerve which has two components, tibial and common peroneal, all the tibial component supplies the hamstring muscles, semimembranosus, semitendinosus, long head of biceps femoris, ischial part of adductor magnus. The only left out muscle, short head of biceps femoris, is supplied by common peroneal component of sciatic nerve. Here we can see the sciatic nerve in the popliteal fossa. This is diamond-shaped popliteal fossa, which is bounded medially by semitendinosus, semimembranosus, laterally by biceps femoris. Here we have medial and lateral head of gastrocnemius. So when we reflect these muscles, that is biceps and semimembranosus and semitendinosus, we can see the sciatic nerve. The sciatic nerve, when it reaches the superior angle of popliteal fossa, it divides into two branches, tibial nerve and common peroneal nerve. Here this tibial nerve just descends down into the posterior compartment of leg, whereas common peroneal goes laterally to wind around fibula and further divides to enter anterior and lateral compartment of leg. Here we can see the division of sciatic nerve. The tibial division just enters straight into the posterior compartment of leg and supplies the posterior part of leg and descends down to the sole. Whereas the common peroneal turns laterally and winds around the neck of fibula. Here in the neck of fibula, it divides into main two branches. One is deep peroneal nerve and superficial peroneal nerve. This deep peroneal nerve comes to the anterior compartment, whereas superficial descends down into the lateral compartment. Here we can see the deep coming to anterior, whereas superficial goes to the lateral compartment. Now talking about deep peroneal nerve, the nerve pierces through this extensor digitorum longus muscle and comes to lie next to anterior tibial artery and descends down, passes beneath the extensor retinaculum. Here the structures from medial to lateral are tibialis anterior, extensor hallucis longus, deep peroneal nerve, anterior tibial artery, extensor digitorum longus and peroneus tertius. So here the deep peroneal nerve, when it crosses the ankle joint, it divides into lateral and medial branches. This lateral branch, it runs just beneath this muscle. This muscle is called extensor digitorum brevis it runs beneath the muscle to end in a pseudoganglia. From the pseudoganglia, the fibers arises to supply the extensor digitorum brevis muscle. Whereas this medial branch is purely cutaneous, which supplies the web space of first interdigital cleft. This part is supplied by deep peroneal nerve. Skin of the first web space is supplied by deep peroneal nerve. So the first web space and adjoining part of great toe and second toe is supplied by deep peroneal nerve. This is cutaneous nerve supply. Rest of the dorsum of the foot is mainly supplied by superficial peroneal nerve. And medially it is supplied by saphenous nerve, laterally by sural nerve. This is superficial division of common peroneal nerve. So the superficial peroneal nerve, it first passes through peroneus longus muscle in the upper 1/3. So this part is divided into upper 1/3, middle 1/3 and lower 1/3. Here the muscle passes through the peroneus longus. When it comes to middle 1/3, the nerve lies just between the longus and brevis muscle. So to see the superficial peroneal nerve, when we just lift this longus muscle, we can see the nerve lies over the peroneus brevis muscle. In the lower 1/3, the nerve just pierces the deep fascia and comes superficially. Here we can see at this region the superficial peroneal nerve pierces the deep fascia to come superficially. It further divides into medial and lateral branches. The medial branch supplies the medial part of the great toe. The lateral branch supplies adjacent sides of here we can see a division from the medial branch supplies adjacent side of second and third toe, whereas lateral branch third and fourth and fifth toe, except the first web space and adjacent skin of first and second toe, which is supplied by deep peroneal nerve. Rest of all the dorsum of foot is supplied by superficial peroneal nerve, including lower lateral part of the leg. So in case if there is any fracture at the neck of fibula, this common peroneal nerve gets injured, which results in a condition called foot drop. So here at the neck of fibula, when the deep peroneal nerve is injured, it results in a condition called foot drop. So what is foot drop? Inability to lift the front of the foot, because the deep peroneal nerve supplies all the muscles of extensor compartment. Tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. So these muscle causes dorsiflexion of the foot. So when the deep peroneal nerve gets injured, all these muscle undergoes paralysis. So it is not possible to do dorsiflexion at ankle joint. So here we can see this is normal foot and this is foot drop. Normal foot where we can do dorsiflexion. This is foot drop where the dorsiflexion is not possible. Thank you.